So before I enter, I'm going to look for any flags or markers, perform any necessary PPE. There are none.
Come in.
Hi there. My name is Aaliyah. I'm going to be your nurse today. How are you doing?
Good, how about you?
Good. Would you mind just confirming your name and date of birth for me while I perform hand hygiene?
My name is Brooke Lipberg, and my date of birth is 4802.
All right, I'm just going to confirm that with your wristband here. And do you have any allergies?
Yes, I'm allergic to pineapple.
Okay, and what's your reaction to that allergy?
I get hives.
Okay, all right. So today I'm going to be doing a head-to-toe assessment on you. If you have any questions along the way or beforehand, just let me know. So I'm going to go ahead and get started. First, I'm going to start with a couple of questions. Do you know where you are today?
Yes, I am at Mayo Hospital
Okay, and do you know why you're here?
because I'm getting a yearly checkup.
Okay, perfect. And do you know today's date?
The 27th of August.
Correct. And do you know who the president is?
Joe Biden.
Okay, perfect. So I'm just going to start with some neurological assessments. All right, so first I'm just going to check your pupils. I'm going to shine kind of a bright light in your eye, but it won't hurt or anything, but if it's too uncomfortable, let me know. Okay, just look straight ahead. Good, they reacted equally. Now can you just squeeze my fingers for me? Perfect, grip strength is strong and even. Now you just push against my hands. All right, and now pull against my hands. Perfect, strong and even. All right, now I'm going to check your skin turgor.
Okay.
Good, that's normal. All right, so now I'm going to listen to your heart sounds. So normally I would go under the gown, but for today's purposes, we are going to do it over the gown. Okay. Sounds good. All right, and I'm also going to check your temperature quick. So this is just going to go underneath your tongue here. We're just going to wait until that beeps. All right, 98.6, good. Now I'm going to check your pulse here for 1 minute. Okay, good, 72 beats per minute. Now I'm going to listen to your pulse again, and I'm actually going to listen to respirations. So just breathe comfortably. All right, 12 breaths per minute, that's normally good. All right, now I'm going to listen to your apical pulse for 1 minute. is also 72 beats per minute. That's good. Now I'm going to take your blood pressure. This is going to be a two-step. So first I'm going to locate the major artery. Is that too tight for you? Alright. So I'm just going to pump this up while feeling your pulse to get a base rate. Alright, it'll get a little tight. Okay. 120. So I'm going to take this cuff off and just sit here for about a minute, and then we can take your actual pulse. 1 minute, okay. Alright. I'm going 20 past the 120. Alright, 126 over 75, that's normal. Very good. Alright. Now I'm going to listen to lung sounds. So every time you feel my stethoscope against your skin, just take a deep breath. Alright, sounds good. I'm just going to have you sit up for me. I'm going to listen to the back. So same thing again. Anytime you feel stethoscope on your skin, just take a deep breath. Okay, sounds good. Now I'm going to check your capillary refill and your pulses here. Alright, less than 3 seconds. Good. Now I'm going to check on your toes. Good. Normal. Alright, now I'm going to feel your pulses. Alright, they're both strong and equal, strength of 3 plus. I'm going to check your dorsal pedis and your posterior tibialis pulse. Okay, good. Good. Alright, both equal strength of 3 plus. Now I'm going to check for sensation on your arm, so just tell me every time you feel my fingers touching you.
Yes? Yes? Yes.
Alright, checking for color and temperature. They're all both equal and looking normal. I'm going to check on the legs. There's no sign of any kind of edema on the arms. Alright, now tell me every time you feel my fingers on you, okay?
Yes. Yes. Yes.
Alright, checking for any kind of edema. There's none. Checking temperature, skin color, everything looks normal. All right, so now I'm going to listen to your bell sounds. So we're going to start with the lower right quadrant and move along that way. Before I do that, do you have any coughs?
No, I do not.
You don't? Okay, perfect. Alright, it's active in all 4 quadrants. Sounds good. Now I'm just going to inspect the contour. Everything looks really good. And I'm going to lightly palpate, just let me know if you feel any kind of discomfort. Alright.
No discomfort?
Perfect. Feels normal.
Took a big old poop though this morning.
Oh, did ya? Let's talk about that. So you said your last bowel movement was this morning.
Yes.
All right. Would you mind describing it for me? The color, was it normal?
It was.
Okay, perfect. Any kind of pain or discomfort with the passing of the bowel movement?
No.
All right. And how would you describe the shape? Would it be pebbly, well-formed, liquidy?
Well formed.
Okay, perfect. And in regards to your urination, how is that? Is that regular for you?
Yes.
All right.
No pain or discomfort.
Okay, perfect. And how would you describe the color?
It's well concentrated.
Okay. All right. So no blood.
No.
All right. Perfect. That's what we like to hear. Okay. So, do you have a history of falling at all?
No.
No. Okay. Perfect. And do you use any kind of ambulatory devices to help you walk?
No.
Okay. All right. So I'm just gonna have you take a circle around the room for me so I can assess your gait. Okay. Very good, very good. Okay, Brooke, well, everything seems to be very healthy, going very well. Do you have any questions for me?
I do not.
Okay, perfect. Then I am going to go speak with your doctor, and we'll bring you breakfast soon. I'm going to perform hand hygiene. There's a call light right here if you need anything.
Oh, thank you.
Pull back the curtain. All right, you have a great day,
Yes,
Brooke.
you too.
Actually, I'm also going to put the bed down and
yeah.
break it.
Yep.
All right, Brooke.
Have a great day.